Good afternoon and good morning to some of my friends and good night or good evening to some of my friends. I'm Sun-Min Kim, the President of Health Insurance Review and Assessment Service of Korea. First of all, I would like to welcome you all to this 2021 International Symposium and HIRA training course. Thank you very much for attending this momentous event from home and abroad and through online and offline. And I want to particularly thank our distinguished speakers who accepted our invitation to speak at this unique opportunity to share their expertise. Before opening the event, let me start by expressing my sincere gratitude to all health workers and disease control authorities in the world, including Korea, who are continuously working very hard to combat this prolonged pandemic of COVID-19. Across the globe, the vaccination rate is fortunately gradually increasing, and some nations declared living with the COVID-19 strategy as their next step. Korean government is also preparing for the post-COVID-19 time to go back to a very beautiful normal life. With the national top priority being safety of the public, we will be able to recover and regain our peaceful life in the near future. Actually, COVID-19 is expected to fundamentally transform not only the health sector, but also many other aspects of our lives in terms of education, economy and culture, including online symposium like today. In the post-COVID-19 era, it is strongly expected that we will observe a rapid development of the fourth industrialization, including AI, big data, and Internet of Things. Health sector should prepare itself to embrace such a great change before the time comes. The COVID-19 crippled the world's economy in an unprecedented manner, but I am confident that the international society can and will overcome this crisis as long as we continue to work together. HIRA will always stay relevant to the global collaboration for the better future beyond COVID-19. HIRA is dedicated to benefit claims review and the quality assessment of the national health insurance system, as well as the international cooperation and exchanges for the betterment of the public health and the national health insurance program, such as building systematic support for quality enhancement and safe use of drugs. I'd like to stress there the importance of drug utilization review system, which has been operated by HIRA. The DUR has guaranteed safe use of the drug for patients by preventing prescription and dispensing of hazardous drugs and by providing customized data based on its accumulated databases. In addition to this conventional work, in recent years, DUR has played a very key role to fight against the spread of COVID-19 by providing information such as overseas entrants, close contact of the COVID-19 confirmed patients, vaccination history, and epidemiological investigation to healthcare institutions and the Korean Disease Control and Prevention Agency named KDCA in a real-time manner. So today, to commemorate the 10-year history of DUR, we are opening 3-day international symposium and training course, which will reflect the history of DUR operation and its achievement alongside with the DUR and ITS used for the fight against the COVID-19. By sharing HIRA's roles and history with the global community, we would like to seek ways to promote international exchanges for building safe environment for pharmaceutical safety management in the future. We are very excited to learn new insights and suggestions offered by our renowned speakers and attendees, including Dr. Nick Klasinga. On the second and third day, HIRA will share its experience as the strategic purchaser. As you well know, HIRA's know-how on health expenditure management will be valuable input for the international society, especially for those who are working towards the universal health coverage in the time of the COVID-19. As you well know, universal health coverage is critically important to recover from this kind of health crisis. The lectures in the training course will cover core responsibilities of HIRA, such as benefit claims review, quality assessment, and benefit criteria management. In addition, the Korea and Central America session is prepared to strengthen exchanges and collaboration in public health sector between two sides. I wish you a valuable and productive dialogue and exchanges. Throughout the overall session, HIRA staff will closely monitor and respond using real-time chat room, so the lecturers can be very interactive. It is my sincere hope that all the attendees and speakers will be able to use this opportunity to take a leap forward for their public sector and advancement in this very hard time of pandemic. I'd like to thank you again. Thank you very much.